cubital tunnel is compression of your ulnar nerve at the elbow. Everyone is, or most everyone's familiar with what this feels like. Anyone who's ever had the experience that we describe as bumping your funny bone, where you get a blow to the back of your elbow and you get an electrical sensation down into your small finger. People who actually have cubital tunnel syndrome, which is more precisely described as ulnar neuropathy at the elbow, have that in an ongoing way for weeks and weeks, months and months, because when your elbow is what we call hyperflexed, flexed as far as it'll go, the nerve makes a tight turn down there, and it gets squeezed. If you have a blunt trauma to your ulnar nerve, it can produce dysfunction in the nerve for extended periods of time. For some people, if let's say they have a job or they like to work out at the gym, they do a lot of curls, they do a lot of bench press, or they engage in any activity that involves prolonged or repetitious elbow flexion, they can get in the situation where they have ulnar nerve sensory symptoms, which is your small and part of your ring finger going numb. They often also have sort of a vague achy pain on the funny bone side of the elbow. Certain people, because of medical conditions, the most prominent would be diabetes, are just predisposed to, their nerves are just vulnerable. So you tell me, can you feel, is this 1 point or 2 points? We have a whole spectrum of treatment options. We have behavior change, occupational change. We do sometimes send people to the therapist to learn what we call nerve gliding exercises, which can be helpful. And we often will put people in splints to help them avoid that position of prolonged elbow flexion. While I would try a non-surgical approach with activity change or splinting for someone who just came to my office and said, my fingers have been tingling for a month, I wouldn't try a non-surgical approach with a patient who came in and said, look, my hand's been numb for 2 years, and I look at their hand and they obviously have muscle wasting. Getting over the surgery is not really very hard. The joints, the muscles, the bones aren't actually getting operated on. And so you just have to heal the skin incision, and the people can be back to doing pretty much whatever they want to do in 2 to 4 weeks.